Welcome to Catalyst Medical Review. Today we'll be covering pediatric immunization. So today I want to talk with you about immunization. Immunizations have been very effective in the United States and have eliminated smallpox and have also decreased the occurrence of diseases like Haemophilus influenza type B, polio, measles, tetanus, rubella, and diphtheria. So what is a vaccine? A vaccine is a suspension of weakened, killed, fragmented microorganisms or toxins. A vaccine can confer active immunity against a specific harmful agent by stimulating the immune system to attack the agent. Once stimulated by a vaccine, the antibody producing cells, called B cells or B lymphocytes, remain sensitized and ready to respond to the agent should it ever gain entry to the body. A vaccine may also confer passive immunity by providing antibodies or lymphocytes already made by an animal or human donor. So here are a few things to remember. Pediatric immunizations are very safe, and the benefits far outweigh the risk. There are a few things that you don't want to forget. Persons who are allergic to eggs should not take the influenza or yellow fever vaccines because they contain egg. MMR vaccines also contain egg products, but in a minute amount, and caution should still be taken. Live vaccines should not be given to pregnant females or immunocompromised persons. Asymptomatic HIV patients may receive MMR and the varicella vaccines. Vaccinations should not be delayed if the child has a mild illness or is taking antibiotics. And if a child's vaccination status is not known, it should be assumed none was given. When to give the hepatitis B vaccine? Okay, let's talk about that. The first dose should be given at birth. The second dose should be given within the first 2 months of birth. The third dose can be given from 6 to 15 months after birth. If a mother is positive for hepatitis B virus, meaning she has the hepatitis B surface antigen, then the newborn should receive both the hepatitis B immunoglobulin and the first dose of the hepatitis B vaccine at birth. The second dose of the vaccine should be given at age 1 month and the third dose at age 6 months. When do you give the rotavirus vaccine? The first dose should be given at 2 months. The second dose should be given at 4 months. And if an infant has to catch up on this vaccine, the maximum age for the final dose is 8 months. When do you give the Tdap vaccine? The first dose should be given at 2 months. The second dose should be given at 4 months. The third dose should be given at 6 months. The fourth dose should be given at 15 months or at 18 months. And the fifth dose may be given at 4 to 6 years old. A Tdap should be given at 11 to 12 years old. When do you give the Haemophilus influenza B vaccine? The first dose should be given at 2 months. The second dose should be given at 4 months. The third dose or fourth doses may be given at 12 to 15 months. When do you give the pneumococcal PCV13 vaccine? The first dose should be given at 2 months. The second dose should be given at 4 months. The third dose should be given at 6 months. And the fourth dose should be given between 12 to 15 months. When do you give the inactivated poliovirus vaccine? The first dose should be given at 2 months. The second dose should be given at 4 months. The third dose should be given at 6 to 18 months. And the fourth dose should be given at 4 to 6 years. All doses should be given before age 18. When do you give the influenza vaccine? The first dose should be given 6 to 15 months. This is an annual vaccination. When do you give the MMR, mumps, measles, and rubella vaccine? The first dose should be given at 12 to 15 months, and the second dose should be given at 4 to 6 years. When do you give the varicella vaccine? The first dose should be given at 12 to 15 months. The second dose should be given at 4 to 6 years. When do you give the hepatitis A vaccine? The first dose should be given 12 to 15 months. The second dose should be given at 18 to 23 months. When do you give the meningococcal vaccine? The first dose should be given 11 to 12 years, and the second dose should be given at age 16. When do you give the human papillomavirus vaccine, the HPV? The first dose should be given at 9 to 14 years. The second dose should be given at 6 to 12 months after the first dose. With respect to pregnancy, HPV vaccination is not recommended until after the pregnancy. In pregnancy, the vaccines that are safe in pregnancy are killed organisms. These include Tdap, hepatitis B, influenza, rabies, and meningococcus. Live attenuated virus and bacteria vaccines are contraindicated in pregnancy. These include MMR, varicella, live influenza, BCG, and that's for tuberculosis, and the polio vaccine. As we conclude this short presentation on immunizations, I do hope that it has served its purpose in allowing you to recall the basic steps that's needed for pediatric immunizations, and that it will help you in your upcoming examination. Thanks for listening, and I wish you well.